So one of the big goals of establishing the Specific Learning Difficulties Network was to bring stakeholders, researchers and members of the public, people with lived experience of specific learning difficulties together.
Today we held a workshop networking with local practitioners and teachers, and workshops like this are extremely valuable in helping us learn from teachers and co-develop resources to translate research into practice.
I think it's incredibly important to be able to come together and link with colleagues on other areas of specific learning difficulties to really support our learners much better, to help them understand their own learning difference and the co-occurrences that can happen as well.
My name's Kate Miller, I'm 17 years old and I'm a Young Ambassador for Dyslexia Scotland. I was identified as being dyslexic when I was 7 and I was so pleased to hear the news. I'm going on to study product design engineering at the University of Glasgow, and I'm delighted to be here at today's event to share our story and hopefully pass on some helpful tips and strategies.
Our two motivations were coordinating research, but starting this dialogue with the stakeholders so that we could deliver impact where it matters.
So charities like Dyslexia Scotland, the British Dyslexia Association have done a tremendous job in raising the awareness of dyslexia. But prominent scientists such as Professor Maggie Snowling here, who is part of our network, is urging schools to move beyond dyslexia. And just last week we see a news article highlighting the significant number of people who struggle with maths. So you're going to hear from Professor Brian Butterworth the most recent science about dyscalculia.
Thank you very much for inviting me. Dyscalculia is not just being bad on standardized maths tests, but dyscalculia is about numbers and arithmetic and not about other branches of maths. So we need more studies, in particular longitudinal studies, genetic studies. We know there's a genetic component, but we don't know the genes involved. Can dyscalculic learners be identified in infancy? And this could mean fewer years of pointless suffering, as well as earlier intervention. We've seen that there's some evidence for tests at 12 months for kids who are going to have trouble later. We need better recognition by educational authorities, governments, leading to support for dyscalculics. We need awareness by parents and teachers, training for professionals, that is teachers, educational psychologists. And we need policy makers to make policy. So policy depends a bit on what science shows, recognition depends on what science shows and what policy actually spells out. And of course all of these things work in a coordinated way.
There is absolutely no doubt that to make progress in understanding dyslexia, which is a complex neurodevelopmental disorder, and to understand the underlying neurobiology, but also then to improve assessment and management strategy, we need to work as part of big teams across disciplines. And to do that, we need a coordination at national level. So this was one of our key drivers for setting up the Specific Learning Difficulties Network, but also to involve from the very beginning the key stakeholders, because even doing the most amazing and challenging, ambitious research would be meaningless unless we make this research useful where it has to be, and that means to the direct beneficiaries. So we want to involve early on in the process the key stakeholders and have this dialogue and develop research program with their input.